In recent years, there have been many major advancements in medical technology. Today, our group is going to share with you some of these advancements.
Hi, I'm Veronica and I did blast assessments.
I'm Ibtaha and I did the Malafine scanner.
I'm Corynn and I did 3D technology.
Hi, I'm Alex and I did Smarty Pants.
Hi, I'm Briana and I did medical robots.
Most people hear the term 3D, they usually associate it with movies. However, in coming years, they may start to associate it with the health industry. Companies such as Cyberspace are making 3D imaging available to hospitals. They created a workplace software that produces 3D images of ultrasounds. This is the first ultrasound application to use 3D vision technology that enables ultrasound images to be viewed in HD with full color fidelity and unbelievable depth. Instead of viewing ultrasound images in traditional 2D way, the Simian workplace produces a more realistic 3D image of the fetus. The use of this device can enhance parental fetal bonding and improve treatment for pregnancy issues and improve pre- and postnatal surgical planning. On the left is a traditional 2D ultrasound image, and on the right is a 3D ultrasound image. As you can see, the one on the right is more realistic.
The next advancement I'm going to talk about is the Malafine. Melanoma is one of the most common forms of skin cancer. It affects many people around the world, and according to the National Cancer Institution, 9,000 people will die from melanoma this year. It's 100% curable if it is detected early. With the advancement in technology, identifying melanoma has gotten easier. Malafine is the first and only FDA-approved system that detects moles on a person and detects whether it is a form of melanoma or not. How does this work? First, the dermatologist wipes the area that will be tested with alcohol and removes any hair. When the gun is pressed against the skin, the scanner emits 10 unique wavelengths of light and penetrates 2.5 milliliters into the skin. The computer records the images and compares them to thousands of cancerous and non-cancerous moles. The computer rates the pics, and anything below a 0 means that it is a low disorganization, which means that the mole has a low level of irregular growth and it is harmless. High disorganization is the opposite. It means that the mole has a high level of irregular growth and it could be cancerous. There are many pros to the Malafine. It is painless, accurate, it has fewer biopsies, it's easier, faster, and avoids scars from biopsies.
Next advancement is Smarty Pants. It's a pair of pants that deliver a mild and painless electrical current to the wearer's backside every 10 minutes in order to prevent bed sores. The Smarty Pants underwear work to stimulate nerves and muscles in the body to replicate the same movements able people perform to prevent ulcers. The Canadian healthcare system spends a lot of money on pressure ulcers. Smarty Pants could potentially save the healthcare system money.
The next advancement is medical robots. An interesting and growing technology found in the medical field is the use of robots in hospitals. Medical technology has now advanced to the opportunity of having robots assist in general hospital routines. The RPVITA robot is the first navigation remote present robot to receive FDA clearance for hospital use. This robot is able to patrol hospital hallways on routine rounds, checking in on patients in different rooms and managing their individual charts and vital signs without direct human intervention. An important aspect of these robots are that they make sure they appeal to patients and are able to gain some amount of trust with them. They try to make the robots have human characteristics so that they seem more relatable. This robot is just the beginning of high advancements in medical technology and is now making it possible for the medical field to advance even more in technology.
Next medical advancement is blast assessment. Shrapnel is not the only danger posed by bombs. The exposure of blast waves from explosive devices may result in traumatic brain injury to soldiers that is not always immediately perceptible or diagnosed. Researchers have devised a simple method based on the blast. Induce change in color of a photonic crystal to provide a quantitative measure of blast exposure. These crystals can be made into strips which could be attached to helmets and other clothing and remain stable to temperatures as high as 300 degrees Celsius. Exposure to shockwaves of an explosion distorts the structure and color of the crystal sensor strips. The color change can provide an instant assessment of blast exposure, the soldier experience, and medical precautions that may have been overlooked can be applied.